Hi everyone, this is Mike and I'm excited to share with you the latest reorganization and re-release of the NeuroRehab app. You can see it right here. This is the app created by Sarah Kraft. This is in partnership with the Medical University of South Carolina. And what we've done is we have reorganized each of the videos so that it makes it much easier for you as faculty or for students to access the videos individually. All the videos in the original app are now reorganized in these different categories. Here you have the interventions. The interventions are organized by functional movement or by impairments. So just to give you a quick glimpse of the key categories that we've reorganized the app in. So here are some key videos. Again, all of these are the same videos, but now all the individual instructions for the videos are here available to assist with student learning. If we go back into the interventions category, under impairments, you can look under hypotonia, you can look under spasticity. Let's take a look at the forearm and hand here. And you can see here some inhibition methods for the hand.
Hand inhibition, method 1. Wraps around the patient's fifth digit, and the fifth digit of the other hand wraps around the patient's thumb. You will place your thenar eminences over the dorsal aspect of the patient's fourth, fifth, and second and third metacarpals, with the thumbs resting lightly over the wrist. The first pressure is a stretch to spread the metacarpals and flatten the arch. A downward pressure on the patient's metacarpals is applied with your thenar eminences. Your finger pads further complete the metacarpal spread by applying an upward and outward pressure on the palmar side of the patient's first and fifth metacarpals.
So you can see that the video is very detailed and useful for helping the students learn techniques before they come to lab or to reference the techniques when they're out with their patients or clients. Now remember, part of the reason why we did this reorganization was so that every single video, individual video like this, can now be added to your lab handouts or lectures. So here, if you click on the sidebar, you'll see that in the educator resource, you can now copy page title with link, go over to your lab handout or your lecture. This could be a PowerPoint. Drop this pasted link in here. You can see that there's a direct link to the technique in the app, as well as going back here, you can copy the thumbnail image and add the thumbnail image to your lab handout. So this becomes a better way for the students to understand what they are going to be learning, or for you to showcase different techniques during your lectures. Let's go back into the app here, NeuroRehab app. The other thing you'll see is we've reorganized the case studies. When you go into each case study, most of them will have a chart review where the students can read about the patient's history, look at their chief complaints, explore the past medical history and the home environment, and learn about the patient's goals. Then there are various videos that you can utilize to observe gait, and there are questions to consider, and faculty members have access to the answers while the students do not. So you can utilize this to facilitate discussion, whether you are online or face-to-face. So the various case studies here cover all the different common conditions, from stroke to Parkinson's disease, spinal cord injury, traumatic brain injury, as well as manual wheelchair and power wheelchair. Here under the resources component, you'll see that there are outcome measures. So available outcome measures are now aggregated into one easy place for you to find them. Here are a bunch of balance measures. If I click on any one of them, it will take you to a document that you can now utilize in your class. The document will often have things like the different cut scores, references, instructions, and methodology on how to perform them. This can be nicely connected to the NeuroExam app that is also part of the app suite. So you can see all of these different outcome measures. Body structure and function measures, cognitive behavior and attention scales, disease-specific measures, gait-related measures, self-reported participation, activity scales, depression and fatigue measures, special scales, and wheelchair measures. So all of this is organized into one place to make it easy for you to access anytime without you having to search around the web to find them. Also, under evidence-based practice, there are different open access type resources like the SRA labs, the stroke evidence-based practice, the stroke edge or the TBI EBP handbooks. All of these are available so that, again, you can access these different resources easily from one location. So here is just an open source SCI evidence modules all here. We just direct you to places that have these available on the web. We've just centralized it in one easy place for you to find. Lastly, if you go back out to the apps, you'll see in this purple side where you have these different simulations and e-learning. So under neurosimulations, in the mini sims, the original interactive evaluation. So this is a full evaluation of a neurologically impaired client or patient, broken up into its key parts. Each of these are now an interactive quiz, so to speak, so that as the students watch this entire evaluation, there will be quiz questions that will help them engage with the material and learn about what the clinician deems as important. What the clinician deems as important. As a faculty member, you have the option here to look at the course key. The course key gives you a full view of the entire simulation, including what videos they're going to watch, what questions are going to be asked, and what the answers are. You'll also note that this particular set of simulations was built to be formative. So there's a lot of rationale to help the students understand why they chose wrong answers or correct answers. So you can, as a faculty member, click through and look through all of these different questions as well as the feedback. It's a very powerful learning experience. So the students would usually click begin to take this quiz. I also want to show you that in this sidebar, you can now assign these to your students as an asynchronous activity or asynchronous. They can be doing it in classroom time as well. So if you copy page title with link, you can see that now if you go to your syllabus, all of these can now be assigned. So here is the date, here is the simulation that you can just copy and paste in. The students will just click on this and it will take them directly to that particular simulation. And when the students have completed that simulation, they are asked to turn in their learning reports into a turn-in folder. So this is hyperlinked to my turn-in folder. So what you can do is to ask them to turn in their learning report here, and you can see the record of their learning, how much time it took to go through the different simulations, how their progress was over the past 5 attempts. And they can just download this learning report. And that downloaded learning report is a PDF that shows you who the learner is, what simulation they did, what was their past history with taking these simulations, and then they can turn that learning report in. Okay, so that is the NeuroRehab app. It is now updated and ready for you to utilize in your classroom. We hope that comes in very handy for you and look forward to your feedback.